So who are the people? I told you, like young people, duodenal ulcer is very common. Old people, gastric ulcer is more common. So H. pylori is one of the very common, if you check the H. pylori, if they do a stomach biopsy in 100 people, in Asians especially, 90%, 90% will have H. pylori infection. But then how many people will really become symptomatic? How many people treat? That's a different question. Even after treating, sometimes it may recur. It runs in families. It's an infection. Surprisingly, before for 2 or 3 decades, the acid peptic disease was not even considered that it could happen because of infection. Now it is proven beyond any doubt that this H. pylori is a bacteria. It's a gram-negative bacteria. It takes like a S-shaped gram-negative bacteria. We used to call it as a Helicobacter or Campylobacter jejuni. We used to call it as Campylobacter jejuni. Now the name has changed to H. pylori, Helicobacter pylori. That's a gram-negative. So who are the risk? Who are the people who may get this H. pylori related acid peptic disease? One is patients, as I told you, elderly patient, COPD, chronic kidney disease patient, tobacco in any form, be it smoking, be it chewing, be it whatever it is. Tobacco is one of the major risk factors of production of because it damages the mucosal barrier that the stomach has. And old age, of course, surprisingly, coronary artery disease, ischemic heart disease also is one of the risk factors for the production of acid peptic disease. And alcohol, of course, yes I know. Former alcoholics, people who take binge drinkers, who take heavy alcoholics, they are also prone for these acid peptic related disease. Obesity is another risk factor, probably because of the pressure, exact mechanism. Diabetes is one of the risk factors for the acid peptic diseases. So coming to duodenal, we'll separate out duodenal ulcer from the gastric ulcer. Can you show the picture, Arbaaz? As I told you, duodenal ulcer occurs more in young people, type A personalities, and gastric ulcers occur in elderly people who are 50 and 60 plus. The endoscopic view of these two, yeah. So the first one is the duodenal ulcer with the arrow. This is the duodenal ulcer, and these are the gastric ulcers. So it's very difficult for you to appreciate this in endoscopic picture, but you should understand that the ulcers can occur in the duodenum as well as the stomach. Okay. So coming to duodenal ulcers, as I told you, it occurs early in life, and 95% of the ulcers occur in first part of the duodenum. 90%. If somebody has a duodenal ulcer in the remaining portion of the second, third, fourth part of the duodenum, it could be, you have to be very careful. It could be something different underlying, some malignancy or some problem. So most of the duodenal ulcers occur in first part of the duodenum. And gastric ulcers, as I said, it occurs late in life, and males are more prone. They are more common than females. And gastric ulcers, usually they may be silent. So how to differentiate? We used to, our teachers used to tell, if it is a duodenal ulcer, the pain starts before the food and after 3 to 4 hours of the eating. Whereas the gastric ulcer pain starts with the food immediately. So the food, if the pain subsides with the food, that is the duodenal ulcer. If the pain increases the food, that is the gastric ulcer. That was the teaching. So it holds good for many patients even now. Yeah, that is one reason is H. pylori. H. pylori also can cause, it's a majority of the patients are having H. pylori, and H. pylori also is very dangerous. It can also cause not just the ulcer, but it can also cause malignancies, lymphomas. So H. pylori is just a bacteria. It can cause ulcers most of the time, but it also can cause cancers in some people. And we have another very important cause is as drugs. Usually NSAIDs. These are the painkillers, non-steroidal anti-inflammatory drugs, which is very commonly used across the counter drug. We don't have to show the prescriptions. You can just buy ibuprofen or aceclofenac or diclofenac. These are the aspirin you can buy across the counter. These are the non-steroidal anti-inflammatory drugs which are notorious, very common. Thousands of people come with drug-induced acid peptic disease. And these are the most commonly used drug, painkillers, and especially after the COX-2 inhibitors came into being, which is again 20 or 25 years back, the safety margin has increased, but these drugs are still causing acid peptic disease and ulcers in many uh, patients. So these drugs not just cause gastritis, they can cause ulcers, they can cause bleeding, they can cause perforation also. So I remember one of our teachers, when I was a student, one of our teachers was a gastroenterologist, Dr. Prasad, the gastroenterologist. He took one tablet of brufen and he had a massive hematemesis, and he was to be admitted in the hospital. We had to give some 6 to 8 bottles of blood, one tablet. Even aspirin also. We use aspirin like water. So many people. Suppose you are in a cardiology department, cardiology hospital. Every patient of ischemic heart disease, coronary artery disease, are given these antiplatelet drugs in the form of either aspirin or clopidogrel. Aspirin is again is a gastric irritant. It causes in many people, and there's no unfortunately there's no dose. Dose, it's not a dose related complication. Even as I told you, even one tablet aspirin, even if it is 75 milligrams, one tablet aspirin can cause the perforation in some unfortunate people. So you have to be very careful. That's why whenever you are giving these painkillers, we should be extremely careful. And we give sometime if it is inevitable, we give proton pump inhibitor along with that concomitantly to prevent these drug-induced gastric irritation and ulcer formation. So after the H. pylori, NSAID is very important cause of this peptic ulcer diseases. Because there's no safe dose here. If you're allergic, if you're prone, you may get the problem even with one tablet, as I said. Smoking is another very important risk factor, major risk factor. This is one of the, it is included in one of the pathogenesis causing peptic ulcer diseases. It causes not just causes the ulcers, but also reduces the healing time. The natural healing time also is reduced because of the smoking, and the drug responsiveness also becomes less in people who smoke. They need to be given long-term treatment if they come with these acid peptic related diseases.